Hi, I'm Madeleine and I'm Big Brother Watch's Legal and Policy Officer. I specialise in the UK's emergency response to coronavirus. February has seen another month of lockdown in the UK, along with the resurgence of the vaccine passports debate, more excessive policing and more unlawful prosecutions. Here are the top 5 things you need to know about the UK government's response to the coronavirus pandemic. Number 1, vaccine passports. Over the last few months, government ministers have assured us that they have no plans to introduce vaccine passports.
That's not how we do things in the UK. We do them by consent. We yet don't know what the impact of vaccines on transmission is, and it would be discriminatory.
Not happening, zipped, and I don't know.
I certainly am not planning to introduce any vaccine passports.
I don't think we will have in this country is, as it were, vaccination passports to allow you to go to, say, the pub or something like that.
But as the Prime Minister laid out the roadmap out of restrictions, he announced a review of COVID status certification.
The third review will consider the potential role of COVID status certification in helping venues to open safely, but mindful of the many concerns surrounding exclusion, discrimination and privacy.
COVID status certification is a vaccine passport by another name, and we will never accept them. Vaccine passports are based on discrimination. Their very purpose is to create a two-tier society on the basis of vaccine segregation. Many people, including pregnant women, people with underlying health conditions, people with less access to healthcare such as undocumented migrants or homeless people, and people with certain religious or philosophical beliefs may be unable to get the vaccine. We can't just shut them out of society. There are many practical obstacles too. Some vaccines may prove less effective against new variants, and there are many unanswered questions about the transmissibility and about how long a vaccine will provide protection for. A vaccine passport scheme could see people with certain types of vaccine or people who might be waiting for a booster jab excluded from society as well. The introduction of a vaccine passport scheme would fundamentally shift how we view freedom and privacy in this country. Showing your papers to go to the shops or to get a pint could become the new normal, and we have no doubt that before long, the remit of these passes would widen and lead to an oppressive digital ID system with more coercion, more control and less privacy. Number 2, a crisis of democracy. During a national emergency, the role of Parliament is critical, but at every step of the way during this pandemic, Parliament has been sidelined, with ministers enacting draconian new laws at the stroke of a pen.
The normal, orderly process of scrutinising delegated legislation has not taken place.
To date, the UK government has passed 382 new sets of regulations in relation to coronavirus, and across the 4 nations, 475 new laws have been passed in relation to coronavirus. Out of this mass of new, complicated restrictions, just a handful of them have been voted on before they came into force. Some of them haven't even been published before they came into force. It's highly ironic that the man who championed Brexit in the name of parliamentary sovereignty has overseen this ministerial power grab. Whether or not you agree with these restrictions or not, it can't be right that these complex new laws are being passed without a debate or even a vote. Number 3, excessive policing. Figures published in February saw the number of fines issued under COVID laws shoot up to nearly 70,000, a level higher than at any other point seen during the pandemic. Some forces have issued twice as many fines in the last month than they have in the rest of the pandemic put together. Senior police officers have said officers are not getting into debate or discussion with people about what the rules are, and that they're issuing fines much quicker than before, claiming that the rules are clear and simple. But this has been contradicted by their own officers. A survey of 12,500 frontline police officers found that 9 in 10 police officers didn't think that the COVID laws were clear, and just 1 in 8 officers thought that their role in policing restrictions was clear. This obvious confusion has led to countless examples of unlawful fines being issued to people who have broken no laws. One example went viral online last month, showing a mother being issued a fine for taking her young daughter for a walk on the beach.
Where have we come from today?
The young mum and her daughter have driven to the beach, but it's deemed unnecessary travel.
Okay, so I'm going to have to caution you now, in case you're not under arrest, don't worry about nothing like that, but I do have to caution you, okay, so you don't have to say anything that may harm a defence we failed to mention now, so which you're later relying in court.
I can't believe it. There is no law against this, which Merseyside police refuse to admit, despite the fact that they revoked the woman's fine. We know that there'll be many other people who've been treated unfairly just like this woman, who didn't have the chance of a news broadcaster documenting what happened. We're calling for an urgent, independent review of all COVID fines. Number 4, the Coronavirus Act. The Coronavirus Act was rushed out in just 3 days in March 2020. It contains a mass of draconian powers.
We are, perhaps let me be the first to say it, implementing tonight and in this bill at least a dystopian society. Somebody will call it totalitarian, though I don't think that's quite fair, but it is at least dystopian.
This Act in its current form allows clumsy and asymmetric authoritarianism.
And I know no member came into this place to put powers like this onto the statute book.
And after nearly a year of it being in force, it has been responsible for an unprecedented 100% unlawful conviction rate. The Act gives police officers the power to detain anyone they think might be potentially infectious. But to date, 246 people, including children, have had their unlawful charges under the Act overturned. There is no evidence that these excessive powers are necessary for the protection of public health, and overwhelming evidence that they pose a risk to rights and the rule of law. That's why we're calling on MPs to overturn these dangerous powers under the Act. Number 5. Police access to test and trace data. At the beginning of February, new regulations came into force that would allow police officers access to test and trace data. This means police can conduct house visits to check that people who are required to self-isolate are doing so. But this is a terrible approach. Medical confidentiality is the bedrock of public health, and it's more important than ever during a pandemic. This is not only abusive of privacy and data rights, it's also counterproductive during a public health crisis. Blurring the lines between the NHS and the police will only deter people from getting tests or giving contact tracers accurate information about their contacts for fear of police visits, fines and surveillance. People who've contracted coronavirus need support to self-isolate. They don't need invasive data sharing or police officers knocking at their door. If you share our concerns, you can find out more about our work at our website. You can subscribe to our mailing list or become a supporter to join the fight.